on your video. Let me see your face, please.
Yes, sir. Oh, hi, sir. Damodharan, sir, newly joined the secondary GNB anesthesia PD.
That's what she mentioned in a message. That newly, you are a post DA candidate.
Yeah, yes, sir.
Where did you do your DA?
In MGM Healthcare, Amjikari, sir.
Oh, they have a DA course also.
Yes, sir. For past 3 years, they are having diploma in anesthesia, sir.
Oh, very good. Okay, right.
Right, sir.
Okay, right. You can go ahead with your presentation.
Thank you, sir. Sir, my topic is about fascia iliaca compartment block and indications and procedures, sir. So, the fascia iliaca compartment block is a regional anesthesia technique that targets femoral nerve, lateral femoral cutaneous nerve, and sometimes oblique nerve by injecting the local anesthesia beneath the fascia iliaca. It provides analgesia for surgeries and involving the hip, thigh, and knee. Indications: hip fractures and surgery, analgesia of necks of neck of femur fractures, intertrochanter fractures, femoral shaft and distal femur fractures, anterior thigh and knee procedures, ICU and palliative care for systematic analgesia, where the systematic analgesia are contraindicated. The anatomy involved in the FICB block, the targets are femoral nerve, lateral femoral cutaneous nerve, and obturator nerve. Where this nerve lies in the facial plane, lies deep to the fascia iliaca, overlaying the iliacus and psoas major muscles. In techniques, there are two types of techniques: ultrasound guided and anatomical guided. In ultrasound guided, there are two types of approaches. One is infra-inguinal approach, one is supra-inguinal approach. Further, we'll see about the infra-inguinal approach. In the infra-lingual approach, the patient will be on supine position, and hip will be in the neutral position. Followed with the probe is placed transverse orientation below to the inguinal ligament, lateral to the femoral artery. The landmarks are the serratus muscle, superior and lateral, iliopsoas muscle deep, and femoral artery in the medial region. The needle incision, it's an in-plane lateral to medial incision. Endpoint, it's piercing the fascia iliaca with hydro dissociation seen beneath it. The drug volume required for this block is 30 to 40 ml. And second type of approach is supra-inguinal approach. In this one, the probe is placed cephalad to the anterior superior iliac spine, aligned to the pelvic brim. Advantage: it improves the spread towards the lumbar plexuses and has better obturator nerve block. Technique: the needle is directed cranially under fascia iliaca, cranial to anterior superior iliac spine. So in the third one is the landmark technique or blind technique. In this one, the lead is inserted 1 centimeter below to the 1/3, 1 centimeter below to the junction of lateral third and medial 2/3 anterior superior iliac spine and pubic tubercle. The needle advancement is, we will fill two pops. One is the fascia lata, other one is the fascia iliaca. The injection amount will be required is it needed 30 to 40 ml is required. Advantages of this techniques are they are simple and safe. The minimal risk of vascular puncture or nerve damage, reduce the risk of opioids, can be used preoperative or postoperative analgesia. Complications: inadequate block, local anesthesia, systemic toxicity, infection or hematoma. Conclusion: FCIB block is effectively and relatively simple regional techniques for the lower limb analgesia. The ultrasound guidance techniques ensures the safety and accuracy in both emergency and elective settings. The supra-inguinal approach offers more complete nerve coverage rather than the landmark techniques and the infra-inguinal approach. That's all. Thank you, sir.
Very good. What about the anatomy of fascia iliaca compartment?
Sir, in the anatomy around this block, it will be around. Will be giving around the femoral nerve, sir. It will be the lateral part will be this. Uh,
So where exactly it starts? It starts above the inguinal ligament or it starts below the inguinal ligament?
below the inguinal ligament, sir.
Fascia iliaca is a muscle which is spreading from above the pelvis into the infrainguinal region. Okay.
Yes, sir.
So the fascia covering that also starts from higher above.
From
Okay. It's a
higher. Okay,
continuation of thoracolumbar fascia, and then comes
okay,
and
sir.
joins with the fascia lata distally in the thigh. So that is how it
Okay,
forms
sir.
a small potential space. The whole idea of the compartment block is it is a potential space which can be expanded by injecting the local anesthetic solution. Okay, so it has an
Okay,
anterior
sir.
structure, it has a posterior structure, it
Posterior,
has a
sir.
medial and lateral structures which have to be described before you start that. All other points are correct and well described. So if you
Okay, sir.
include the anatomy of the fascia iliaca compartment, so there are two different wordings in which the question can be asked. If they ask
Okay.
fascia iliaca nerve block, then it indicates only the nerve of femoral, obturator and lateral cutaneous nerve of thigh. On the contrary, if the question is worded as fascia iliaca compartment block, then the anatomy of the fascia iliaca compartment, what are the structures making that potential space also has to be included in your answer. Then only the answer will be complete. Okay.
Definitely,
I will
definitely,
just
sir.
I will just show you how that answer has to be